This series covers medical vocabulary you will need for different situations. The words are British English based on the UK healthcare system, but I will mention any key differences to North American systems. Keep watching for 7 keywords which are very useful when discussing anaesthesia, and please subscribe for more medical English videos. Today we are discussing anaesthesia. This is not the easiest word to spell, and it is difficult to pronounce even for native English speakers. Let's break down the pronunciation. An-ness, like the Loch Ness Monster. Thes, Anaesthesia. The stress is on the third syllable. Anaesthesia. Now let's think about what this word means. We need to go back to the ancient Greeks. Anaesthesia literally means the absence of sensation. As a medical specialty, it is the practice of blocking sensation. For a more formal definition of the specialty, we have this definition from the Australian and New Zealand College of Anaesthetists. I won't read it out as it is quite long, but it might be worth pausing this screen and reading it in full at your own pace. Now let's think about how the word anaesthesia might be used in day-to-day medical practice. As a reminder, the short definition is the practice of blocking sensations. So this doctor might be explaining anaesthesia to a patient or a non-medical acquaintance. Anaesthesia has developed a lot over the last century and is very safe when performed correctly. Now let's think about the word anaesthetic. This is pronounced very similarly to anaesthesia, with the stress over the third syllable. However, this is pronounced as a short sound, thet, anaesthetic, as opposed to the longer thes in anaesthesia. Now we will talk about the meaning of the word anaesthetic. It can be used as a noun, and this refers to medication given to block sensation. This can be a local anaesthetic to block sensation over a certain area, for example for a procedure. This can also refer to a general anaesthetic. This means medication to cause a patient to be asleep for a procedure. The word anaesthetic can also be used as an adjective. This is used to describe anything relating to anaesthesia. Let's look at some examples. Firstly, let's see how the word anaesthetic can be used as a noun when explaining to a patient. Simple procedures may be performed under local anaesthetic, which means you are awake, but the area operated on is numb, so you will not feel pain. For more complicated operations, you may be given a general anaesthetic, which means you will be asleep and not aware of the procedure. In the second example, we will see how the word anaesthetic can be used as an adjective. Go to the anaesthetic office and speak with the anaesthetic secretary, Jane. She can access the anaesthetic rota and tell you if Dr. Jones is at work today. Here, the doctor is giving instructions to somebody who may be looking for Dr. Jones. The doctor uses anaesthetic office to describe the office that is used for the anaesthetic team, as opposed to that of a different specialty. We can assume in this case that Dr. Jones is an anaesthetist, which brings us on to our next word. Anaesthetist. An anaesthetist in the UK medical system is a doctor who gives anaesthetic medications. Depending on the individual anaesthetist, they may also have other roles, but this is outside the scope of this video. In North American countries, this type of doctor is known as an anesthesiologist. Now let's think about how to pronounce anaesthetist. Knees, like the body part. Thet, ist, anaesthetist. For anaesthetist, the stress is on the second syllable, knees, anaesthetist. Let's look at an example. Hello, my name is Abby. I am an anaesthetist. For our next word, we will look at anaesthetize. This is pronounced very similarly to anaesthetist, with the stress again on the second syllable, anaesthetize. In North American English, this is spelt with a Z, but still pronounced the same, anaesthetize. To anaesthetize is a verb. It describes the action. To anaesthetize. There are other ways you can describe this action, for example, to give an anaesthetic, or to induce anaesthesia. However, in my experience, you are most likely to hear to anaesthetize. Let's see how an anaesthetist might use to anaesthetize in a sentence. We will anaesthetize this patient in the anaesthetic room. Now for a few more words related to anaesthesia. Airway. This means the passage by which air reaches a person's lungs. Anaesthetists are considered airway specialists as they ensure this passage remains patent during an anaesthetic. An endotracheal tube is one of the most common devices used to protect the airway while the patient is asleep. This is often shortened in everyday use to ET tube, or often just tube. To intubate. This is a verb. Technically, it describes the action of putting any sort of tube anywhere. However, in medical use, it means to put an endotracheal tube into the trachea. Let's look at how all these words may be used together. Please prepare an endotracheal tube. I plan to intubate this patient to protect their airway. Let's summarize the words we have learned today. Anaesthesia. The practice of blocking sensation. Anaesthetic. The medication or the adjective. Anaesthetist. The doctor. Anaesthetize. The action. Airway. The passage of air into the lungs. Endotracheal tube. The device placed into the airway. Intubate. The action of placing a tube. I hope you have found this video useful. Please subscribe and check out my website. If you wish to practice this vocabulary as flashcards, please check out the link below. Thank you.